I want to talk about the PCR test. This is very, very important to understand. Remember, amplification is the conversation. Let's take a look at this PCR test study. Viral RNA load as determined by cell cultures as a management tool for discharge of SARS-CoV-2 patients from infectious disease wards. Okay, so this is the article I want to take you through. In this article, they have a graph that I'm going to try and use to explain what we're really talking about here. So let me explain what this study did. The study essentially looked at PCR tests in a large group of people. They were looking at what rate were they infected. And they also, after the PCR test, went and cultured the samples to see if they could see virus, to see how accurate the test was. How do they culture it? Essentially, they take that little bit of DNA or RNA and they put it in an animal to see if it can grow. This is what they discovered, okay? Now let me show you how this works. Right here at the bottom, what you have is the amount of cycles, right? Right here we have 13 cycles, 15 cycles, 17 cycles, 18 cycles. Remember, the discussion is amplification. Each time a cycle is run with a PCR test, you're amplifying more. You're going deeper and deeper in, right? It's like an NCIS where they have a license plate in the video, and you're going deeper and you're going deeper in to see if you can read what's on that license plate, to see if there's something there, if there's information. And so each cycle amplifies it even more. Well, here's what the study looked at. When you look at this entire graph, this over here is the percentage of positive culture, meaning after they did the test, then they took and said, was it accurate? Yes. What they found was when there was about up to 17 cycles, 17 amplifications, 17 cycles maximum, right there, you have a 100% success rate. If they ran your PCR test through 17 cycles and it comes out positive, 100% chance you have COVID-19. But here's what gets interesting. After 17 cycles, when we go to 18 cycles, 19 cycles, we start watching the quality of the information is dropping, right? At 27 cycles, now you have about a 60 to 70% chance of having a correct diagnosis and therefore a 30 or 40% false positive rate, all right? Now here's what gets critical. So let's look at, this is it. 20% effective, meaning 20% will be a correct positive. Follow this across, right here. Right here, okay? How many cycles? Are you only 80%? Are you only 20% accurate? 33 cycles. 33 amplifications with a PCR study, and now you only have a 20% success rate. 80% of you are getting false diagnosis. And then after that, it drops off. I mean, look at this. You get to 35, 38, you go this way. No chance. Your coronavirus test is positive. Maybe it shouldn't be. Okay? What does it go on to say? This is their investigation, New York Times. Remember, after 33 cycles, this thing is useless. Most tests set the limit at 40 cycles, a few at 37 cycles. The CDC's own calculations suggest that it is extremely difficult to detect any live virus in a sample above a threshold of 33 cycles. Officials at some state labs said the CDC had not asked them to note threshold values or to share them with contact tracing organizations. North Carolina's state lab uses the Thermo Fisher coronavirus test, which automatically classifies results based on a cutoff of 37 cycles. A spokeswoman for the lab said testers did not have access to the precise numbers. Sorry about that. Officials at the Wadsworth Center, New York State Lab, have access to CT values from tests they have processed and analyzed their numbers at the time's request. In July, the lab identified 872 positive tests based on a threshold of 40 cycles. In Massachusetts, from 85 to 90% of people who tested positive in July with a cycle threshold of 40 would have been deemed negative if the threshold were 30 cycles, Dr. Mina said. I would say that none of those people should be contact traced. Not one, he said. This is outrageous. And when we were looking at this, I reached out to a friend of mine or an inside source, an ER doctor, and I said, what test are you using at your hospital to test the PCR test for COVID-19? And do you happen to have any idea of how many cycles that test is using? I wanted my own real information. And so he sent over the brochures for Luminex. Is it Luminex? Here we go. Luminex, COVID-19 testing and research solutions. This Ares is the product made by Luminex. Ares SARS-CoV-2 assay. Look what they explain. When you use this test, development and evaluation of 2 SARS-CoV-2 RT-PCR laboratory-developed tests on the Ares automated sample-to-answer real-time PCR system. Here's what they say. Forget about the Celsius and 95. Look at the bottom. How many cycles? 45 cycles is what this test is using. And Luminex is one of the top 4 PCR tests in the United States of America. And this is what's getting us locked down. What's getting us locked down is a bunch of 40 cycle PCR tests that are 100% inaccurate. Do you see the scam? And in case you think, well, Del, I mean, that's a perspective. It's the New York Times, and maybe you're agreeing with them. Why don't we go to the great God of medicine we've all been bowing down to and see what he has to say about the cycles being used in PCR tests? Hold on to your seats, folks. They know.
What is now sort of evolving into a bit of a standard that if you get a cycle threshold of 35 or more, that the chances of it being replication competent are minuscule. So that if somebody, and we have patients, and it's very frustrating for the patients as well as for the physicians. Somebody comes in and they repeat their PCR and it's like 37 cycle threshold, but you almost never can culture virus from a 37 threshold cycle. So I think if somebody does come in with 37, 38, even 36, you got to say, it's just dead nucleotides, period.
He actually says it can be a little bit frustrating for the patient and the doctor if you come in and you get the 37 cycles that test positive and, obviously frustrating. It's not frustrating to be a patient. It's frustrating to be a nation that is being destroyed by this lie, Tony, and you know it.
Cases skyrocketing.
New cases.
More reported cases.
More daily cases than ever before. Yesterday, we had 83,000 cases.
We do see slight upticks in cases.
The coronavirus crisis is intensifying.
Doctors say the numbers haven't looked this concerning since the start of the pandemic.
Rates of growth are alarming. They seem to be as bad or worse than they were back in the spring.
We are having some of the largest outbreaks that we've had during the entire pandemic. And 9-10 months into this pandemic, we are still largely not quite prepared.
We have a lot of work ahead of us.
As lines for COVID testing stretch blocks in some states, the results are rocking regions big and small.
There are new rules for travelers going to New York. The state will require visitors from non-neighboring states to be tested before and after they arrive.
The governor is now shutting down all indoor dining starting this Friday.
Chicago seemed to have this more under control than other regions of Illinois, but that's no longer the case.
Fargo, North Dakota implementing the state's first mask mandate.
In the last month especially, our active cases have more than doubled.
California Governor Gavin Newsom taking a rapid test at this new facility that will double the state's testing capacity.
Why is testing, in your view, key to opening schools and opening businesses again?
It's the fastest route to actually know where you are.
And public health experts are sounding the alarm about the holidays.
As experts are warning, with the current trend in cases, your Thanksgiving and your Christmas plans could be at risk.
Coronavirus updates. United States tops 100,000 new virus cases in a day for the first time ever. The U.S. reported its second highest number of new COVID-19 cases on Election Day with more than 91,000 infections. And then last one, U.S. coronavirus cases surpassed 9 million, driven by the silent epidemic of asymptomatic infections. That's what we're seeing, right? Gigantic rise, biggest numbers ever. We got to do something. We are terrified. Once again, Scott Atlas made this as clear as he possibly could in this tweet. Take a look at this. Anticipating hate, because this is fact, not opinion, but cases in blue and deaths bottom red, hashtag facts matter, hashtag perspective. Just leave that there. I want you to really wrap your head around this. The deaths are in red. It doesn't matter how many cases and all the testing that's going on, cases going through the roof, deaths going nowhere.